major announcement just moments ago that should give pause to every person, vaccinated or not, about the state of this pandemic in the United States. First, the Centers for Disease Control and Prevention, the CDC, is revising its mask guidance. They're now recommending those in high or substantial virus transmission areas, even those who are fully vaccinated, wear a mask.
So you got the COVID vaccine because they told you to get it, or they forced you to get it. Because as Joe Biden himself explained, it was your patriotic duty to get it, to protect yourself and protect others. Good people do that. And the only way we can stop the spread of this virus and return to normal life is by taking the vaccines. If you get the shot, you can have hot dogs on the 4th of July. It turns out that the COVID vaccines, those wonder drugs that were absolutely perfect, that were more impressive than the moon landing, the drugs you were not allowed to question in any way, don't actually work in the way they told us they did. The science is more complicated than we thought. There's still an awful lot we don't know. These are, after all, experimental drugs, and they're behaving like it. The bottom line is that a huge number of vaccinated people are getting COVID, and some of them are getting very sick, even dying. That's true around the world. It's true in Iceland, Gibraltar, Israel, in small countries with high vaccination rates that have seen big spikes in COVID cases. And it's every bit as true here in the United States. According to the CDC today, fully 3/4 of the people infected in a recent outbreak, for example, in Massachusetts, had already been vaccinated.
I'm not infected. I'm not infected, please.
Nothing happened the way it was supposed to happen. 6 billion people on Earth when the infection hit.
Everyone dies.
Number 3, the virus can survive on surfaces for up to 24 hours. Never touch anything that's not disinfected.
God forgive us.
Your town is being quarantined.
We got 19 dead. We got 100 more infected. It's spreading like a brush fire.
What are you talking about?
If one of them's got it, then 10 of them have got it now. And if one of them gets out of Cedar Creek, we have a very interesting problem.
If that bug gets out of there, 260 million Americans will be dead or dying.
I know that some of us have doubts about what we're about to do.
A group of New Jersey parents is taking legal action to block any mask mandates in public schools this fall. I'm joined now by Kelly Ford, the mom leading the lawsuit, and Bruce Afrin, the group's attorney.
The emotional, psychological, and physical toll that a year and a half of masks on kids, specifically my children and the parents who have spoken to me, have taken greatly outweighs the impact that the virus, including the Delta variant, has on kids.
So let me ask you this. Do you believe masks work as a measure to mitigate the spread of the virus? Let's just start there.
Well, I think that the more important question is, does the government have a right to force children to wear masks for up to 8 hours a day?
I hear that, but I'd like an answer to the question I asked, please. Do you believe that masks work to stop the spread of the virus?
I think there's many cases where especially with kids, the masks don't work because they're not being worn properly. There's arguments where people aren't wearing the correct type of mask. So I think that that is something that cannot be controlled in all of New Jersey's schools.
Bruce, I think we probably should stop the conversation. I think the rest of what you have to say is moot because we have to start with a science base. We have to agree on the facts first.
Or do you want to hear the guest speak, or just you give the talk? Now, the answer is very simple. Excuse me. We live in a constitutional democracy. We do not have government by doctors meeting in conference rooms at CDC and issuing press releases. CDC is an advisor to the government. It should issue studies.
I understand that.
Let me finish. It should issue studies, and Congress and legislatures should take this up. We do not have government by private conference room and governors making judgments based on 4 or 5 unknown doctors in CDC headquarters.
Okay, so Jennifer, you're a really interesting place to start because you are a registered nurse. And so you, as I understand it, worked in a COVID unit. You saw the worst of the worst, and I would think that you would want to get the vaccine as soon as it's available, but I know that you have hesitance.
Basically, I just want some more research. We've been seeing a lot in the hospital, like just between, the patients and the employees that I work with, we're seeing a lot of adverse reactions after Pfizer, Moderna, and J&J. So it makes me a little leery because you don't know, until you take it, if you're going to get one of those reactions or not. They don't have the research to support it or deny it. I mean, you can't verify either way right now because there's not enough proper studies done to really show it. And I think we need a few more years, at least a couple more years, to see any long-term effects.
Diana, I want to move on. You did come around and you got the first vaccine.
Yeah, so it's crazy because I'm a DJ, so I travel a lot for work. So my doctor and my wife, they were kind of, pushing me towards getting the vaccine, and I really wasn't for it. The crazy part, so I eventually I gave in and I got the first vaccine. 2 weeks after getting the vaccine, I contracted it, which really, really turned me off about getting the second.
Thank you, Mr. Chairman. I call up Cruz First Degree 2. This is an amendment that would prohibit U.S. participation in the creation of a vaccine passport.
The estimates are that somewhere between 25 to 50% of the population habitually breathes through its mouth. So these steps are breathe through your nose all the time. I don't care if your nose is clogged. If it's clogged, find a way of clearing it. You have to breathe through your nose, people. Yeah. The second one is to breathe slowly, to breathe less, of course, and to exhale fully. A lot of us are conditioned, this is very typical Western mindset, to put more and more in, air on top of air. In order to get a full breath of air, you need to get the old breath out, and you need to focus on your exhales and exhalations. So a simple thing, and just because something's simple doesn't mean it's effective. Look at nutrition. The most simple nutrition is the most effective. After 50 years of trying to find ways of hacking out, I'm going to pull this vitamin out and put it in this powder. We're back at square one. Oh, whole food.
Yeah, just eat vegetables. Yeah.
Okay. We've been saying this for a long time. So yeah. Breathing is the same.
Have you seen through the research and the science, people applying this new way of breathing, or I guess old way of breathing, that people are able to do things like cure asthma or other respiratory problems through a healthier breathing technique? Have you seen this?
So I've talked to dozens and dozens and dozens of these people who had asthma for 50 years, who had been on bronchodilators, oral steroids. I should also note that there's been a ton of research looking into nasal breathing and how that is your first line of defense against COVID.
No way.
So not only does the nose filter out pathogens and bacteria and viruses, but Dr. Luis Ignaro, who won the Nobel Prize in the 90s, has found that release of nitric oxide interacts directly with viruses to kill them. So
no way.
Yes.
So breathing out through the nose, is that what that does?
Breathing through your nose at the whole time. Okay.
In and out.
So not only is this filtering, because we have nasal hairs, we have cilia, we have all these other structures, but the release of this nitric oxide, the first round of SARS, which was like 14 years ago, they would expose mammalian cells to nitric oxide, and those cells would live so much longer. And it's no coincidence there are 11 clinical trials right now looking into giving patients, guess what, nitric oxide to help them defeat COVID and to blunt the symptoms of COVID after it happens. We produce nitric oxide in our noses.
In this series, I'm going to teach you about brain and heart coherence. And with this knowledge, what if you could strengthen your immune system by changing your thoughts and feelings? To be more present, to make better decisions, to think beyond the limitations or the conditions in your environment. We're seeing common people around the world doing the uncommon, in a sense, becoming supernatural. And I'm talking about healing chronic health conditions and even rare genetic disorders that medical science has had no solution for. My job as a doctor for 31 years, as well as a lecturer, author, and researcher, is to not just talk about what is possible, but to show you the latest data that supports my work. Your thoughts can have an effect on your brain, your body, and your life. I'm Dr. Joe Dispenza, and I'm going to show you how to rewire your mind, your heart, and your body with this all-new series called Rewired.